Welcome to Hacking Health, the podcast for future-focused health experts, thought leaders and change makers who are passionate about making health accessible for everyone. I'm your host, Sarah Bartholomews, and in this podcast, we'll be diving deep into the world of health tech, exploring the latest innovations, sharing success stories, and discussing the challenges and opportunities that lie ahead, specifically in Australia. Our mission is to empower our listeners with the knowledge and insights that will help them drive change and make a positive impact on the health system. Because together we can get to the future faster. In this episode, I want to address and explore the differences between health tech and medtech, two distinct fields within the broader umbrella of healthcare and technology. While the two fields share some similarities, they also have some key differences in terms of focus, application, and scope. But first, let me tell you a bit about myself and why I'm passionate about this topic. So why am I doing a deep dive into hacking health? Well, I'm a lawyer and I have been for 20 years. I come from a family of medical and health professionals, including one general and several orthopaedic surgeons, a dentist, a physio, a nurse, and my cousin Gabby is just starting her specialist training to become a paediatric immunology expert, or something that sounds pretty cool like that. Because of this, I'm passionate about making the health system better for all Australians, including medical and health professionals and tech innovators in the space. I'm constantly seeking out innovative solutions that can improve patient outcomes and enhance the efficiency of healthcare delivery by exploring the stories of entrepreneurs who are driving change in these areas. I want to shine a light on the potential for technology to transform healthcare for the better. Through this podcast, I aim to share the stories of health tech entrepreneurs and their startups, as well as experts in the field, investors and regulators who are shaping the future of healthcare technology. We'll explore the challenges they face, the lessons they've learned, and the impact that they're making on the world of healthcare, and our insights from a legal and corporate governance perspective. Now, on to health tech versus medtech. When comparing health tech and medtech, it is important to note that they are two separate fields within the realm of healthcare technology. Despite sharing some similarities, they have a distinct difference in their focus, application, and scope. Health tech, also known as digital health or e-health, is a relatively new and rapidly growing field that focuses on the use of technology to support healthcare delivery and management. Health tech solutions can be found in a variety of settings, including hospitals, clinics, homes, and workplaces. The main goal of health tech is to improve patient outcomes, enhance efficiency of the healthcare delivery, and also lower costs. Common health tech examples include electronic health records, telemedicine, mobile health apps, wearable health monitoring devices, and personalised medicine tools. MedTech, on one hand, refers to technology or medical devices. This field has been around for much longer than health tech and is more focused on the development of commercialisation of medical products and devices. MedTech encompasses a wide range of technologies, from surgical instruments and imaging equipment, diagnostic tests, and implants. The main goal of MedTech is to improve patients' health and well-being by developing innovative and effective medical devices and technologies. So what are the differences? Well, one of the main differences between health tech and medtech is their focus. Health tech is more focused on the use of technology to support healthcare delivery and management, while medtech is focused on the development and commercialization of medical products and devices. This means that while health tech may involve the use of medical devices, it also encompasses a much broader range of technology that supports healthcare delivery and management, such as electronic health records, telemedicine, and mobile health apps. Another key difference between the two is their application. Health tech is often used in non-clinical settings, such as homes and workplaces, as well as clinical settings. In contrast, medtech is primarily used in clinical settings like hospitals, clinics, and medical laboratories. The scope of health tech and medtech also differs. Health tech encompasses a broad range of technologies and solutions that support healthcare delivery and management, while medtech is more focused on specific medical devices and technologies. MedTech products are often subject to rigorous testing and regulatory approval before they can be brought to market due to the potential risks associated with their use. Despite the differences, there are some similarities. Health tech and medtech are closely related fields that share some common goals and challenges. Both fields are focused on improving patient outcomes and enhancing the efficiency of healthcare delivery. Both are subject to regulatory oversight and scrutiny. Both fields also face challenges related to data privacy, interoperability, and patient engagement. What legal and corporate governance issues arise? Well, due to the similarities, the legal and corporate governance issues that arise can be similar. My article on what Australian startups can learn from the experience of Theranos and Elizabeth Holmes highlights a number of the issues, despite Theranos being a US example. It's in the show notes for you to enjoy. As a highly regulated space, understanding the legal and regulatory environment is critical, and seeking advice early can help avoid pitfalls. Being risk aware and nurturing a positive culture will help your medtech or health tech organisation thrive. An area of keen interest for medtech and health tech directors and boards is privacy, data and cybersecurity. These are areas where the agreements and processes you have in place will be critical. Enough of that for now. In future episodes of Hacking Health, we'll be discussing a range of topics related to health tech, such as telemedicine and virtual care, artificial intelligence, it's the buzzword at the moment, data privacy, cybersecurity, and regulatory issues. Through these discussions, I hope to bring you insights and perspectives that can help you navigate from a legal, regulatory, and corporate governance perspective this rapidly evolving and exciting field. That's it for the first episode of Hacking Health. I hope that you enjoyed this deep dive into what I hope Hacking Health will become. We'd love to hear your thoughts, so please leave us a comment or review. We're going to keep the conversation going on our private Facebook group, You Legal for Doctors. You're welcome to join us there. Thanks for tuning in, and remember, together we can make healthcare more accessible and efficient for everyone.